The point James Carr makes here is your videos are great and I watch many of them, but religion belongs in the family and church, synagogue, mosque. Private schools not paying VAT is a decision the government can make, and if it prevents tax benefits on religious schools, so be it. Perhaps religious schools could take the model from Catholic schools. It's just my opinion. I agree with everything else in the video. After all, homeschooling parents pay VAT. No VAT laptops for homeschooling, for example. I'm a great fan of homeschooling. I think if you can do it, it's a great option. As for private schools with promoting a religious background, and particularly I think this is a reference to the closure of the Emmanuel School in North London. The issue is that the Treasury said that small faith schools would not close because of the VAT imposition. This is clearly not true. The Treasury has also said that the tax on farmers will only hurt a small number of bigger farms. That also is not true. I'm doing a chat tomorrow morning, the Sunday brunch, and I hope some of these issues will come up because they need to be explored by people greater than I am, and they and I'm hoping that we'll be talking about the tractor rallies and the importance of farming in our country, but also maybe have an opportunity to look at the issues of VAT on private education. The imposition of a tax is fine, but it should be done in a prudent and time-sensitive way. To impose a tax so suddenly, in such a knee-jerk fashion, and taxes which are targeted at what is perceived as an elite, it isn't, of course, it's a perception, smacks of spite, malice, and some sort of class warfare or culture divide. It's unpleasant to witness, and it's done without real thought. The other subject which I hope we'll look at is the issue of Luigi Mangione, and that's a fascinating subject because there we got the 26-year-old Maryland lad who killed a United Healthcare man, and you know, I know some people on the left are getting excited about this and talking about talking about the issues of private healthcare, which are relevant here too. But the bottom line is somebody was killed, and and killed by somebody who was a privileged individual studying data engineering, who had filed off the number from his gun, who had a silencer, a fake ID, who had a handwritten manifesto. Everything points to some sort of premeditated act. This doesn't seem to have been an accident. And Thomas Dickey, his attorney, says that he will allegedly plead not guilty. And I must say, I find this extraordinary. Of course, we have to, in any form of legal situation, we have to start with the presumption of innocence. And the fact that there's so much alleged evidence to suggest that he committed the crime doesn't prove that he committed the crime. This is effectively circumstantial evidence, and the manifesto, I'm sure his attorney will say, simply demonstrates his frustration. There are problems, I gather, in the way the evidence was collected, a chain of evidence, and that these objects were not properly collected or properly assembled. There may even be an alibi, but there is nevertheless, it seems, compelling evidence. Now, the debate about private healthcare is a much bigger debate, and it's reasonable to have something of that debate. But it's not that private healthcare is something which is being proposed here in the UK. Private healthcare is already here, and it's not working well. Why is it not working well? Because it's entirely tied up to the NHS, and the NHS is a system which is effectively a national form of private healthcare, where decisions about treatment are based not on need, but on expense, and that must be wrong. And we're now being told this with a certain amount of satisfaction by the government and by healthcare officials. We need to find the money to support the healthcare that we have on offer. And the private healthcare system, if the national health, if the NHS is good enough, then we don't need a private healthcare. It's exactly the same argument that we could place against the private schools. If the national schooling system is good enough, then we don't need private schools. But to destroy private schools, or to destroy access to private schools, particularly for people who are struggling, because they meet a need that cannot be provided by the community, this is both spiteful and foolish, because it's not going to improve the state-provided system. Destroying bits of the private school system doesn't improve the state system. Destroying bits of the health service doesn't improve the NHS. What we need is a wholesale reboot of both, which means we need to rethink what our education should be offering. We need to rethink what our National Health Service should be offering. And we need to strip away a lot of the detritus. A lot of the bureaucracy is unnecessary and is simply there to keep people at their desks. There should be a principle that no bureaucrat is paid more than somebody who's actually doing the job. And yet you look at the National Health Service, and the people with the biggest salaries are the bureaucrats. There's many of the same issues in schooling. The people with the biggest salaries don't teach. This is madness. Utter madness. And we need to change this way of thinking. The people who are doing the job need to be paid the most.